Yes, what distinguishes schema therapy from other couples therapy approaches? Well, that's a big question because there are a lot of approaches, and I cannot sort of speak for many of them, but I could say that some approaches have a focus maybe more on practical issues for couples, and that is a lot of couples that seek help might have practical issues like how to navigate around house chores and these things. But the aim in schema therapy is on the emotional connection with a couple. So any approach within couples therapy that has that focus would be more similar to the schema therapy approach. The core principles for schema therapy for couples is, well, there's certain levels to try to unpack and understand. And the first thing is, well, depending on what order when you meet a couple, it could vary depending on the situation and the couple and where they're at. But you want to get an idea of the broader dynamic, the day-to-day dynamics. To give an example, sort of, is it that one person is more dominating and the other one more withdrawing, or is it two very dominant people and a lot of clashes, or are they both very emotionally withdrawn and they're living sort of in the same house or apartment but separate lives? It's trying to get that broader dynamic first, like having a more of an outside view, and then move closer and see, okay, so if that's the sort of default dynamic, when are the clashes? Are there clashes when things get to a point where maybe the one being withdrawing and the one dominating senses that, well, now I had enough, and then it's an explosion, and what happens then? Or these kind of things. So one principle is understanding the broader dynamic, but then move in by looking at specific situations that they both in the couple can share as situations where they don't feel heard, understood, respected, cared for, and on the contrary, maybe taken for granted, abused, or not loved, or treated as a failure. All these things that tie into the most sort of core of what we need in a relationship to feel heard, seen, respected, and valued. So, and when we move into those situations, then the general pattern is no longer what we focus on, because then it's what is within the process when that happens. And as we have in schema therapy, we have both the theoretical concept of schemas that represents sort of experiences that we have, and when we get into a situation that we recognize emotionally, associate with it, it triggers us, and we fall into what we call sort of mode flips. So we want to understand with a couple, when there is a problem situation, the process of it. So if one person is triggered by the other, we want to see, first of all, understand the mode sequencing within the person. So it's what goes on with you. First of all, each partner needs to receive help to have a deeper understanding on why they're acting as they're acting, because it's helping that person to, if it's explored in an atmosphere of empathic curiosity and validating whatever experiences it, then it helps that partner to have more empathy for themselves, knowing where these reactions today come from. But not only the partner, him or herself, but the listening partner. Because many times they get to see and have a much more clear understanding why my partner is reacting like that. And many times they might have, if a couple has been together for long, they might have shared childhood histories, but they never connected the dots. So they think, well, that was then, so, well, I'm sorry for you, but, you know, that doesn't give you the right to treat me like this. And so a core principle in the treatment is to really try to arrange it within the session so that they get some experience of feeling heard and understood in their pain, right? The empirical evidence for the efficacy of schema couples therapy is having, I would say, the same problem as most couple therapy approaches. We don't have any randomized controlled trial for schema couples therapy. And that could be really needed and to have. But also there are the difficulties because couples might have different sort of reasons why wanting therapy. So the aim in schema couple therapy is to help couples connect. So it is a, if that is what you're focused on when you see a couple, it could be a couple with a lot of their own issues, mental issues. It could be having, as we call it within the psychiatric setting, a personality disorder and so on. Or it might be a couple not having these issues, as I mentioned. Either way, if you have difficulties in your connection domain in terms of having needs met and feeling safe, moving and helping two individuals to build trust and allowing themselves to feel safe, to emotionally open up, it's a long process. So I'd say that a lot of the interventions and the views are not apart from how we treat individual clients in terms of the interventions, the views, because individual schema therapy is also an interpersonal and relational approach. So a key difference is that in individual therapy, the bond is established initially between the therapist and the client in what we call a reparenting bond, from which the client is also helped to grow with his or her individuation and to be feeling sort of free and independent and so on. So we have not made any studies with this whole approach with couples. But what we have, I'm part of a small research group in Australia, and we've developed a inventory to assess how a client experienced that their partner is behaving in ways that are tied to the fulfillment of specific needs related to schemas. We have not published it yet, but we have the data and we're writing it up. And that will be an important research tool to specifically be able to monitor throughout treatment sort of how the needs are being met within the relationship. There are people doing research on this, but in terms of schema couples therapy and sort of a whole treatment, we don't have those kind of RCTs. Well, I would say I've seen couples for many, many years, and it's all variants of couples, but any couple that needs to work on their emotional connection is suitable. And I would say that since the approach is sort of a development around schema therapy, which is a treatment approach aimed to help people with long-standing problems, and also, as we call, personality disorder problems. Any client having severe personality problems and symptoms related to that are suitable. Because I would say that if you are a couple seeking couples therapy and there are a lot of personal issues, it can be really difficult to get help on a more couples therapy or couples counseling. So if you go see couples therapy in a schema therapy approach, the therapist will be able to work and navigate these things better. Yeah. I can only talk for myself because there are within the Schema Therapy Society, there are several couple therapists, and we might do it somewhat differently. For me, usually it's couples making contact to my institute, and they want to see if I have availability and so on, and usually they write some description. And what I need to see at that point, it really need to see how is my own schedule in terms of what I see. Because if I take on a couple, I really want to be able to follow through. So that's one thing. One thing is, would I send inventories in advance and so on? I don't do that. I know people might do that, but I don't, because assessment tools like inventories and so on is very valuable information. But since when I treat my couples or the couples that come to me in my practice, it's not research like that. So I don't give an inventory because I'm doing research. So when I use the inventory, which I do use at times, I use it as a clinical tool. It's only one path for gaining information out of many. And so in the preparation phase, I just then tell them, I give them a time for a first appointment. And the first appointment, I always try to, take a look at the couple on face value, what seems to be going on. And I usually ask about experience, how does it feel to come? And what are your experiences of having therapy? Do you have any? And if so, what are those experiences? And if not, what do you anticipate around this? Because that is preparing myself and them for what could this be. So the preparation phase for the couple is meeting me, me looking and asking a little, trying to understand what their expectations are, and how do they view a relationship, and take it from there. And how long the sessions are, I know that within the Schema Therapy Society, we might do a little differently depending on the therapist. I usually try to meet with the couples for 90 minutes. Definitely the first sort of couple of sessions, but for many of them, I continue seeing them for 90 minutes. Sometimes it will be less, it could be 50 to 60 minutes, and so more later on in therapy, because in the beginning it's helpful to really get a chance to connect with each partner and explore, and the assessment phase and the conceptualization of the schemas and the modes and these things, that's sort of the most important part of the treatment, because without really fully understanding the dynamics and the overall dynamics and the processes, we don't know then when we move towards change what we're working with. And after having supervised both in individual and couples therapy for many years, I tend to see that that's sort of the most challenging for both therapists and for clients, because clients want help now, and that's understandable. And a lot of therapists want to give help now, so they want to start to work on change, but you start changing and applying interventions and you don't really know the dynamics and so on, you will get into so much trouble. Yeah, the key mechanisms that create change is parallel to the main mechanisms that perpetuate schemas. And there are three main focus points that we need as therapists have our eyes on. We need to help to explore what is there a bias in the way the person perceived things happening? Because if you perceive things happening in a biased way, it will trigger emotions, and these emotions you will start to try to manage them yourself. So if a triggered emotion that you are being perceived as stupid, it could trigger an inner critic that will just fuel that. So you need to see what is the inner process, and that's why we do the schema mode sequencing in a situation, because that will be one factor to focus on. The trigger, how it's perceived, if it is some bias in the perception, and see what it activates, the inner process. That's one area. But if whatever theme, like if it's feeling defective or like a failure, the way to cope with that could be by either going on attack or avoiding or surrendering. And that's just the style, right? Because it's a protective mechanism. But the actual behavior coming out will then be a behavior that is driven by the perception. And the behavior will have consequences with the interacting elements. It could be with a partner or people at work and so on. So the behavior response, that will be a focus area, because you need to know that that behavior will reinforce that what you felt was true, right? But the third part is that, well, if it was only to change an individual within him or herself and life was a beautiful paradise, well, then things would be good. But a lot of people, as I have mentioned about schema chemistry and why we're drawn to certain partners, it means that if we have many schemas and quite rigid coping patterns, we tend to create a world around ourselves that fits our schemas, meaning that we might be drawn to work situations with a toxic work situation, maybe with standards around values that are not healthy for the individual. They might be drawn to partners that are toxic and living in a life area that doesn't suit that, right? If you're an overcompensator and you overcompensate with your friends and where you live, that will itself be a factor that will perpetuate the schema. So the change is to work on resolving the schema's perception. And the only way, as we see it in schema therapy, is that since it's an emotional experience, it needs to be a corrective emotional experience of the opposite. So that's why we want to activate emotions in the room. And when the client perceives the partner as doing something, they need to experience that it might not be so. And it might also be the opposite. And that might be the first time when they were 100% emotionally sure that that was what was happening. But the first time they emotionally also realized that maybe it was not. So that's being exposed to the needs in the here and now. So that's one very important mechanism for change from what is perpetuating the whole circle. So next we need to actually break the behavioral response in the coping. Because as long as you then start falling into your coping pattern, that will again be reinforcing the prior experience. But if the life areas and relationships also outside the couple's relationship it's a toxic environment where the values are not congruent with what we need, or if it's very negative attitudes, we need to see that as long as the couple, because the couple might have friends that they go to dinner with, and the friends are very overcompensating, and when they notice that when they're with these friends, it's very hard to be open, emotional, and all that, then we need to help them to find life areas that is by themselves not frustrating core needs. So there are 3 focus areas. The schema and the way you perceive things will draw an emotional response, and it might activate an inner critic or demanding parent, whatever, or it might come out as a direct response, but that behavioral response we need to focus on and help breaking, but also the external potential needs frustrating environment. There are the same interventions that we use for individual schema therapy are effective interventions, but I could highlight that the connection dialogue is certainly a very important aspect. A connection dialogue can be used, that intervention, throughout sort of quite early on in the treatment. It's about expressing your need towards your partner by saying that maybe like, when you did this, it made me feel this, and I get the urge to respond like that. But what I need from you is to ... right? Just to be trying to advocate for your need. And the couple look at each other, and along the process, in the beginning it can be really step-by-step helping as a therapist, but when the couple can look at each other, facing each other, and you could help them look at each other and say, when you did this, it made me feel like, and it gave me the urge to, about what I need. And then the other one could take over and said, when you did this, it made me feel, and I had the urge about what I need. And then help them to invite the partner to explicitly meet the need. Imagery, rescripting and imagery for assessment is a very effective intervention. Chair work could also be helpful with the clients, but I would say that, at least in my view, one of the most central interventions is you as a therapist, that you are being a reparenting person. Having that said, the difference with individual therapy and couples therapy is that, well, I need to be a reparenting person in a sense for each partner, because the more I manage to have each partner feel heard, seen, safe with me, then it will reduce anxiety and allow them to explore themselves. But I'm not the primary parenting person as in individual therapy, because it's them that need to be that person for each other. Yeah. But in terms of interventions, you as a therapist, you are part of the intervention in that sense. But then if we take imagery and connection dialogues, I would say, are the key aspects. Well, are there specific challenges for schema couple therapists? Yes, there are several challenges because we're helping people that are struggling like we all are, and one challenge is that if we see a couple where there are very rigid coping modes, like really detached and so on, there is no quick way to help a client to start to feel trust in order not to be detached within the therapy room and with the client. So the challenge is it might take as long time as it takes. And for anyone who has treated individual clients with maybe severe personality disorder, you know that there's no quick way of establishing some security within the therapeutic relationship, and it's no different within couples therapy. So that's a challenge, that you might have too much expectations on the change process. Another challenge is that a couple can be very volatile, and if you're not used to working with clients that could be very aggressive or attacking because you have a private practice and you see more clients that are calmer in that sense. But in couples therapy, first of all, the partner comes to your room with its trigger. So you need to be prepared because there can be a lot of hot emotions. But usually one of the partner might not be the kind you see in your individual work, but they're there now. And if you're not ready that you can be attacked yourself, both verbally and threatened, and a lot of bullying and attack from a partner, it's a challenge to create safety in the room, because unless you're able to create safety for the person acting like that and yourself and for the partner, well, you will not get nowhere. So you need to be very ready to be responsive in the here and now, and know how to set clear empathic limits and hold the limits. And that's a challenge when it's more volatile couples that might direct frustration, anger, and threats toward you as a therapist because you're starting to stir up things. So that can clearly be a challenge. Most of us within this couple therapists, within this ISST, the Schema Therapy Society, we see couples, during the assessment, we meet with the couple, we see them together, but we also tell them that we would like to meet with them each individually to have a chance to assess things that might be difficult in the beginning to share. But what's important if we do that is that we are very open, that we don't keep any promises. So whatever you tell me, I will not say, well, I will not mention that later. But it could be things tied into various things with like drug abuse and things in childhood and that they have experienced, one has experienced and not ready to talk about, and these things. I can only talk for me. I usually see the couples, and if the need is there to work individually, we build a trust within the therapeutic sort of relationship. So I do see maybe one of the partners a couple of times individually, and I might see the other one, and so on. It's an open approach in that way, but the most of the change we try to do with the couple. So if I see them individually, it's only to help them within their relationship. If we look at the relationship, the relationship is an environment where there has to be some norms and ideas and governing sort of principles about what is our moral foundation and what are our values, because we are a system. It's like a microcosmos of a society. And if I'm going to help a couple, no matter what religious beliefs or what ideas they might have in terms of values and so on, what are their schemas? What are their triggers? What are their frustrated needs? So if you take a polyamorous relationship, I'm not the one to say if it's morally right or wrong. It's not up to me, but I could see, well, if one partner has a severe abandonment schema and mistrust, and maybe the other one has also, but is coping differently, and neither of them are emotionally attuned to their feelings because they're detaching because they don't want to feel the pain. And then they might have a coping mode, and the coping mode they're in when they're detaching has a lot of values about having open relationships and so on. And maybe the person who seeks therapy is the one advocating strongly that we should have an open relationship, and the other one falls along with that and is okay. But the one advocating the most have this severe schema, so when the partner is having these relationships, it just constantly triggers anxiety that they don't really know how to cope with, and they become, so then I see, well, at this point in the two of you in your life, how is it helping that part feeling all that when you arrange your relationship like that? I'm just helping them to see, and so whatever cultural ideas you have, well, as long as they're not perpetuating the schema and they want to be able to have an emotional bond, and they seek therapy because they do want to have an emotional connection, well, I don't have to tell them that it's not working for them. I couldn't say it cannot work for other people, but for you now, we need to address this. So that's how we would deal with it. And that is somewhat easier when it's a couple because it's up to them how they, are you fine with that? But you're fine with something that keeps giving you all this pain. So at this moment, it doesn't really seem like it's helping you. Yeah. Well, what specific training a therapist needs in order to work with couples in couples therapy is, well, it's the same as if you do individual therapy. You need to, in individual therapy, we really emphasize for the therapist to really do self-exploration, and the best thing is to seek out the schema therapist and learn to see about yourself and all these things. If you want to move on and see couples, you need to really address with yourself, what are my experiences in couples relationships, in my personal experience? What are my own views and values? What do I think a healthy couple relationship is? What is a loving relationship? What is my views on all these aspects involved in a romantic relationship? In order to know when I'm sitting with a couple that I'm not just perpetuating things that are coming from my own schemas and my own ideas about a couple relationship. And that becomes even more important if thinking about cultural differences and so on, because you might intuitively think that this is right and this is wrong, and you fall into a trap of not understanding that you need to look at this couple. So build on your experience as if you're an individual therapist to really focus on your own experiences in love relationships, both if you ever experienced something meaningful and if you didn't, and what was part of you and what was part of the other person. Try to get help to explore what was our dynamic, our pattern, because then you have a lived experience at least of what you need to focus on. So don't start out just reading books and trying, we need to integrate our learning with real emotional evidence of what we see. So having guidance of some trained couple therapist to maybe have a few sessions will be sort of the best way to start, in my view.